Welcome, everyone. Good morning. My name is Ben Forsag. I'm the Senior Director of Strategic Partnerships for the Portland Business Alliance, Greater Portland's Chamber of Commerce. Thank you for joining us today for our COVID-19 Recovery Roundtable. Everyone here at the Alliance hopes you are staying safe and healthy. And while our region continues to navigate phase one reopening, we encourage everyone to practice physical distancing and help all of us contain this pandemic by wearing your mask. Very important stuff. We say this at every event, but there are not enough thanks available to all of the frontline healthcare providers and workers for their continued efforts at this time. During this COVID-19 pandemic, we continue to work diligently in being a resource for our community. We have set up a page that is COVID-19 focused and is updated frequently. And follow us on social media for updates. You can find us on Twitter, Instagram, and everywhere else. A recording of this presentation and links for all of our resources will be available on our website shortly after we wrap up this morning. We'll also be sending a recording of the presentation to everyone who's watching live or registered. Of course, none of these events could happen without the support of our members. Thank you so much. And today we have an incredible sponsor I would like to thank, U.S. Bank. Founded in Oregon in 1891 with a long history of serving businesses of all sizes across the region, U.S. Bank is one of Oregon's most philanthropic companies and provides living wage to 5,000 employees in the Portland metro area and across the state. Thank you to U.S. Bank and to Stacy Dodson, who is on the executive committee of the Portland Business Alliance. We appreciate your support for this important series. This morning, we are joined by Multnomah County Health Officer, Dr. Jennifer Vines. Dr. Vines has been leading the regional public health response to the COVID-19 outbreak. She joins us today to discuss the key factors affecting the process for reopening our economy. We look forward to discussing with her the implications of being in phase one, as well as necessary preconditions for further opening. We know that you all probably have questions. You can share your questions by using the Q&A tool that's at the bottom of your Zoom window. The only questions we will be reviewing and presenting to Dr. Vines will be submitted through this tool. When you submit a question, please remember to include your full name, your organization, the location of your business when submitting your question. And if you have a comment, you can share it with everyone using the comment function. So without further ado, let me introduce Dr. Vines. Dr. Vines, welcome. Thank you for joining us today.
Thank you. I appreciate the invitation. It's good to be with you.
So I'm going to start off with a broad question here. Multnomah County is at the end of its first week of phase one. How did that week go?
I think it's a totally valid question. I would almost turn that over to the audience to tell me how this week went for them. I am spending my days largely either at work or at home. So I'm curious how things are looking out and about. I will say it's a reasonable question to want to know, what does the data tell us, for example, about reopening, first week. But really, it's going to take time to understand the implications of reopening. So people will decide, what risks they're willing to take. They may venture out. They may be infected and then take time, of course, to show symptoms or spread it to someone else who may show symptoms. So unfortunately, this virus spreads really quickly, but our understanding of those patterns of transmission tends to lag a bit. So I wish I had a better answer for you at week one, but I think we will need to wait for data to come in and for just a better understanding as we hear back from the community on what things look like out there.
So TBD. This is actually an interesting opportunity. If you're watching the presentation and want to share what the experience has been for your organization, please feel free to do so in the comment section. So let me ask you, let's step back a little bit. Can you walk us through the behind the scenes overview of what was going on in the last month to prepare Multnomah County for the reopening?
Sure. So, the common metaphor is that we're trying to build the plane as we fly it. So, as we were taking positive lab reports and contacting people who were positive and doing our contact tracing, we were having to scale up massively to meet the state's criteria. Some of those criteria were more straightforward than others. Our health systems have created quite a bit of capacity, and we're doing very, very well at the time of reopening in terms of just bed availability. Personal protective equipment, global supply chain appears to be back online, which is great news, because there was a time when I know I was losing sleep over how our frontline workers were going to protect themselves. So that was great. You saw Multnomah County adding some metrics specifically around Black, Indigenous, and people of color, or what we refer to as BIPOC, and specifically wanting to make sure that our scale up of contact tracers, these are the public health staff that work with people who are positive to identify who they may have exposed, and then in turn work with all of them to stay away from others until they're no longer infectious. We scaled up massively, but also with a real focus on making sure that group reflected our county. So people who are bilingual, bicultural, across the board. And it was a mix of people with sort of community health worker skills, some nursing skills, epidemiology, which is disease tracking, management, of course, to keep track of all of this data that then has to be entered and entered correctly, and then subsequently analyzed to answer questions like the ones you have today. So that was all going on in conversation, of course, with our regional partners, so Clackamas and Washington counties, and with the state. So a lot of moving parts there. And again, it's a chance. This question is a chance for me to acknowledge the many, many people at Multnomah County who are working long hours and who are brilliant, dedicated public servants. So again, I am often the face, but I represent so many people who are really doing great work.
Thank you. So I know Multnomah County has seen a spike in COVID-19 cases over the last few weeks, in fact, setting records for most increase in cases in one day. Is there an idea of what's causing these spikes, and what policy and guidelines is the county putting in place to address these issues?
Sure. So we're keeping a close eye on the numbers. We do see them increasing. Unfortunately, that mirrors trends nationally and globally. So what we can say is that the spike in case numbers, it was not because of like one big outbreak that explained a bunch of people testing positive. What we can say is that we are seeing smaller outbreaks, smaller clusters, if you will, among household and close social contacts or social networks. So we think that in the phase one reopening, in signaling that it was okay to go into phase one reopening, and honestly, just human nature of wanting to reconnect socially, what we suspect has happened is that people have reconnected with loved ones and friends that maybe they haven't seen in a while, and they may not be taking the precautions of the face covering and 6-foot distance and good hand hygiene, because it's natural to feel safe and good around people that you know, or want to be in close physical contact with them. So we've really been pushing the message about being cautious in your social contacts, limiting the number of your social contacts, and continuing to take those precautions of the physical distancing and the face coverings as well. We're doing some very culturally specific outreach to certain groups that have been affected by these smaller outbreaks. So again, we're learning as we go, and the more we test, the more cases we find, and we know this virus spreads easily. So we've been saying all along, we expected cases to increase, and unfortunately, we're seeing that now.
So you've alluded to this a couple times. Let's dive into it a little bit more. When looking at the number of COVID-19 cases reported by the Oregon Health Authority, it's really clear that this disproportionately impacts communities of color. So how is the county addressing this disparity, and are there specific resources dedicated to those communities?
Thank you for this question. So in public health, it is not new that racism underlines so many, if not all, health disparities that we see across the spectrum from cradle to grave. So this was already something that we were working on in our day-to-day. I've also said many times that this pandemic shines a spotlight on everything that's wrong in our society, whether it's people who are unhoused, racism, the way our kids are educated, the way childcare is available. So it's incredibly complex, and we had to be honest up front that we wanted to connect with communities of color, but we needed to rebuild trust. And again, that's not something that's done in the course of a few weeks, but we are making our best effort. The way we're doing that is by engaging community health workers from these communities, engaging regularly with their community leadership, again, ahead of any data release that may speak specifically to their community, we're talking to them first, for example. We've prioritized them in terms of our community personal protective equipment distribution, and we have set up testing in East County that's very low barrier, and that's available Mondays and Thursdays. It's by appointment, but it's for people who may not have a doctor, who may not have health insurance. It's intended to be easily accessible. So those are, we have more work to do, no question, but those are some of the things that we've put in place. We've also, just in terms of metrics, we've also been careful to include a look at hospitalizations among this group, so that we weren't in a situation where overall hospitalizations were trending down, but for, again, these communities of color or others, that they were actually trending up. So sometimes those disparities can hide or get diluted in the data. And so we wanted to specifically keep an eye on that. So those are a few examples, again, more to be done.
Excellent, thank you. So the governor announced a face mask requirement in public indoor spaces beginning June 24th. What does enforcement of this rule look like, and what outreach is the county doing to ensure businesses are complying with the rule?
So face coverings have gotten a lot of attention. They are absolutely strongly recommended by public health as one of many ways to lower the risk of transmission as people potentially venture out in phase one, or again, connect with friends and family. I know that people jump very quickly to the question of enforcement, which I'll get to, but I wanted to say that in general, public health works through voluntary means and through changing social norms. So I think through leadership modeling this practice, through face coverings and masks being easily available to people, and for it to just become a normal social expectation, I think is the best outcome for this particular tool that we have in preventing COVID-19. So to that end, we're trying to promote those normalizing ideas. We want these face covering items to be available. So we're asking businesses to make them available to their clients, or to have them ready for purchase for a very low price. And we're hoping that this just kind of takes hold as the thing to do. There is a legitimate issue from communities of color. They've been very vocal about not feeling safe, feeling like they can be profiled if they had their face covered. And we've seen, of course, in stark terms, what it can mean for a person of color to be viewed with suspicion, and for any kind of low-level enforcement to go to end in something very, very serious. So we're really discouraging interpersonal enforcement. It's more at the business and social organization level and through community messaging. So specifically for enforcement, Multnomah County has the option of turning enforcement over to the state, which is what we will do. And I believe there is a way, a channel for registering complaints. But again, the interpersonal piece, our local public health staff are not going to be policing individuals. We ask the community not to necessarily be policing each other, to understand that there can be real reasons that someone cannot tolerate a face covering, either for medical reasons or other reasons. And so we ask people to just distance yourself, use your face covering, and there will be a mechanism for registering complaints if there is a setting in which face coverings are technically required, and there's evidence of noncompliance.
Excellent. So we have a question that just came in from John. John, when you have a chance, share your organization and where you're watching the presentation from, so we can share that. He asks, would you recommend businesses that are able to work or function remotely continue to do so until a vaccine is available or better treatments are available? Alternatively, what guidance will you give as to when a business should move back to the office?
Absolutely, great question. I would say for businesses who can continue to function through teleworking, keep doing it. The more we can keep people from mixing, the better chance we have as a community to slow the spread of this virus until there is a vaccine or treatment. So absolutely, if you can run your business virtually or through telework, or if you can run part of it through telework, absolutely keep doing that.
Let me follow up to that with another question. So face masks are obviously the topic of conversation here. What other low-hanging fruit in terms of safety precautions can businesses do, particularly in the retail sector, to make sure it's a safe environment for their customers?
Sure. So first choice is if you can telework, keep doing it, as I've just emphasized. Next best, if you are sort of client or customer facing, first thing would be to make sure you have a good sick policy in place and that your employees know about it and that they're encouraged to use it. So if they feel unwell, they should not be at work. The next is to maintain the 6-foot physical distancing in terms of the layout and flow of your setting. And then the last layer would be face coverings being an expectation, easily available with polite reminders to everyone, allowing room for some people to share that they may be in an exempt category.
Thank you for that. And again, I want to remind everyone, if you'd like to submit a question, please do so using the Q&A tool. We're going to have ample time to address your specific questions. Let me move on to a question that's on a lot of people's mind, I'm sure. So we're just entering phase 1 right now, and both Washington and Clackamas have been in phase 1 for the past 3 weeks. How are those 3 counties coordinating during this reopening process? And can you walk us through how that coordination will look if and when Clackamas and Washington County enter phase 2?
So this is actually a better question for the Multnomah County Chair, Deborah Kafoury, but I will, just so everybody knows, as Multnomah County entered phase 1, the governor, among many things, she linked Multnomah, Washington, and Clackamas counties essentially together for moving through the different phases, recognizing that in a large Portland metro area, it really didn't make sense for us to be out of sync in that way. So in theory, Multnomah, Washington, and Clackamas counties should be working together, looking at our metrics together ahead of entering phase 2. I think, our counties look differently, geographically, politically. So I think there may be some questions ahead about exactly how that looks and exactly the timing. But my chair could speak better to that than I can.
Thank you. I have a question here from Jennifer, who's watching. Again, Jennifer, when you have a chance, please share the organization you're calling from. She asks, to what extent is the county considering that as it opens, people in vulnerable groups are being told by the county to stay home, but their workplaces are reopening and asking them to come in? Should the county do more to ensure that people at higher risk are not put into this position?
So this is a real challenge. So for people who are in a high risk category, either by virtue of their age or underlying medical conditions, it's not clear how to integrate them into reopening and how to do that safely. So certainly employers, and again, I'm not an expert in labor law, but in general, employers should be watching out for their more vulnerable employees, knowing that they are at higher risk of serious illness and complications from this infection. And I would hope voluntarily accommodating that, knowing that it's really our whole goal is to protect those most vulnerable among us.
Thank you. So how can the business community support what the county is doing with this reopening process?
Thank you. So I'll end up just re-emphasizing a few of my points. So first is if you can continue your business virtually or via telework, please do that. Again, the less people mix in our community, the better chance we have of slowing the spread of the virus. Again, for those who are client facing, making sure your employees know to stay home at the first sign of illness, making sure they're aware of sick policies. I would hope that those would be paid sick policies. Then the 6-foot physical distancing set up in your physical space, and then finally face coverings as a general expectation. Again, easily available, either free or for purchase, and then just knowing, acknowledging that some people will claim an exemption from that particular requirement, and allowing for that by using the 6-foot distancing as a backup.
Thank you. So we're nearing the end of my prepared questions here. I've got a couple more I'm going to throw at you. Again, I do want to encourage anyone who's watching, if you have questions you'd like Dr. Byans to answer, now is the time to submit those. Here's a wild card question for you, Dr. So obviously there's a lot of scary stuff going out there in the news and a lot of uncertainty. What gives you optimism around the situation we're facing moving forward?
So thank you for this question. I spend a lot of my days problem solving. I would say my sense of optimism comes from my general experience and belief that most people want to do the right thing. So we tend to focus on those who don't, or who, or who register a complaint. But in general, I think most people understand that what they do affects other people. And this collective notion, again, we're a very individualistic culture, but I see us moving towards a sense of a collective obligation to protect each other's loved ones who are high risk. And so I see people moving that direction, and that's what makes me optimistic that we're going to get through this.
Thank you so much for sharing that. I appreciate you accepting that wild card question. This is your last call if you're watching and would like to share a question. While we wait for those to come in, Dr. Vines, anything else you would like to share with the audience today?
No, I think only that, again, we're in uncertain times. We're learning all the time about this virus. And as we look back to, 3 months ago, we know some things now that we didn't before. There are still things we don't know about this virus. We're still looking at data. We're trying to figure out what metrics can signal to us, maybe what they can't signal to us. We're watching experiences in other jurisdictions to try to learn what works and what doesn't. I think in the setting of a global pandemic, I would just emphasize we are in this for a while. There is a lot of virus out there, and just given the fundamental freedom of movement that people expect and that I respect, there will constantly be the potential for reintroductions of this virus into Oregon. And so we are going to be on alert and in this for a while. So again, I want to thank Multnomah County residents for respecting the stay-at-home order that paid off hugely in terms of letting personal protective equipment come back online, giving our hospitals and health systems a chance to prepare for a potential wave of illness. So those preparations are ready should we need them, which I hope we don't. And it also helped us drive the level of infection down, I think, to a level that we were hoping to manage. But as we see now, again, given that humans are social creatures and given that this virus spreads so easily, we are now seeing the increase in cases that unfortunately we expected. So I guess I would just ask for continued flexibility and patience with your public health system as we figure out next steps and how to get through the next weeks and months.
We got a couple questions here. One of those, to your point, comes from Nick Budnick. He asks, Dr. Vines, do you expect the recent increases to continue and potentially grow exponentially as the latest modeling indicates? That's from Nick at the Portland Tribune.
Yeah, thank you, Nick. So the notion that the increase could grow exponentially. So this notion of how long it takes for cases to double, or the doubling time. We're seeing that time globally. We're seeing the time for doubling start to shrink, which is a red flag around viral spread. I think locally, it's something that we're watching closely and could certainly happen. So I think we need to proceed with caution. And I think now that we're into phase 1 reopening, we're now looking really closely at the numbers to figure out what do they mean? When might we need to slow down? What else can we do, again, to protect our most vulnerable? So do I think it's possible? Yes, because we've seen it happen elsewhere. I can't predict what's going to happen locally, but I can say that it's something that we're paying very close attention to as we think about, again, the days and weeks ahead.
Great. We have a good question here from Mira McLaughlin. She's the executive director at Music Portland, trade association for the local music industry. She says the Portland independent music economy employs tens of thousands of people, but was the first to shut down and has no reopening plan in place. Are you working collaboratively with specific industries to map out appropriate protocols for these venues?
I would say thank you for the question. I would acknowledge that the arts, in particular our local artists and musicians, enrich our community hugely. I know the Multnomah County Chair has held various listening sessions with different sectors. I don't know specifically if she has held such a session that would include this particular sector, but I'm happy to elevate this as a request.
Another question comes from Allison Reynolds. She's from Stoll Reeves, a great Portland Business Alliance member. Thank you. She says, there's been a lot of news coverage about increased infection among younger people. Is this changing the strategy of the county?
So the notion of younger people being infected is definitely out there. A couple things to say about that is, one is that there is no age group that is completely safe from the most severe effects of this virus. So even people who, again, you wouldn't expect to get seriously ill, there are cases of people getting very ill in all age categories. Of course, that risk goes up with age and other underlying health conditions. I think there's this notion that younger people may be taking risks because they are healthy or they are particularly social. And so the concern is that could that predict viral spread from them ultimately into vulnerable, high-risk older people? That is not yet clear, but that is something that is on my mind as we think about viral spread and just the overall viral burden, if you will, in our community. And the higher that burden, the higher the chance that the virus is going to start to make it into people who could get seriously ill.
We have a really good question here from Amy Keeter. Amy, I hope I pronounced your last name correctly. Amy's with Comcast Corporation, another good PBA member. And she asks a very pragmatic question I think a lot of people are struggling with. She asks, if someone needs for work to be out in the world, and her husband is a pilot in this case, what's the best procedure to returning to the home environment safely?
So very pragmatic question. Okay, so if you are out in the world, absolutely you want to be using a face covering. You want to be doing really good hand hygiene. You don't want to be out in the world if you're at all ill. Once you return home, if you want to be super cautious, you want to take off whatever clothes you've been wearing, put them in the laundry, make sure to at least wash your hands and face, and then be on the lookout for symptoms of this virus. And again, isolate yourself immediately if you feel at all ill.
And we have one final question here from an anonymous attendee. And this might be the toughest one you get today. Okay. He or she asks, as we move into the longer term new normal, are there any phases businesses might prepare for while we wait for a vaccine? Are there other twists and turns we might see in a global health epidemic?
Certainly, I have to acknowledge the twists and turns that we've already been through around our understanding of the role of face coverings. We've done a complete 180. I'll acknowledge that. Again, our understanding of the virus has changed. We thought children were essentially fine. That has not turned out to be the case, as we hear case reports of this unusual post-infectious sort of inflammation syndrome that can make some children very ill. So I would say there are plenty of twists and turns ahead. I can't predict exactly what they are, which is why I think my job is to share what we do know, what we don't know, and what might be ahead, and then ask everybody to remain flexible, to remain vigilant, and to work again with each other and with your local public health and governmental public health system, along with all the healthcare systems, everything. Again, we say we're all in it together, and we very much are, in terms of, again, having to come together as one unit to respond to this pandemic.
Thank you. Now, Dr. Vines, I know you are probably one of the hardest working people in Multnomah County right now, and we appreciate your time that you've taken with us. Thank you for being here. And thank you to our attendees for taking the time out of their day to join us. Make sure to join us for our next event. Save the date for our July forum on July 15th. The Alliance invites partners in diversity to share their latest research on how employers can better retain their professionals of color. You can learn more and register at portlandalliance.com. And as we mentioned, we will continue to share updates with you on our website about COVID and other activities we're doing here at the Alliance. Until we meet again, I just want to encourage everyone to stay safe and please stay healthy. Again, thank you, Dr. Vines.
My pleasure. Thank you.
Have a good day.